So currently, the status quo of mental health care is broken. It's one of the sub-industries of healthcare that has just suffered over the past decades, and as a result of that, we do not have the bodies that are needed to treat those that are in need of care. What we're seeing is that a, a majority of the mental health care, a majority of mental health care is actually being done in the primary care setting. About 85% of all mental health care is done in the PCP office, in the primary care physician office. Yet less than 10% of these physicians actually feel like they have the acumen or the resources. Granted, they've taken like 2 classes in med school, and they don't feel comfortable with treating their patients. However, about 75% of all antidepressants are actually prescribed in the primary care setting. So
Wow.
that really tells a very interesting and beautiful story that these primary care clinicians are the first and only line of defense when it comes to treating their patients. They have to do something about it, and the only thing they can do is really provide a prescription. And what that shows is that it will it will come to a point where there'll be patients who would fill the prescription and take the prescription, but not having that talk therapy to be able to handle the other side of what's needed to make the medication work and to do actual talk therapy. The clinician will also tell the patient to call the back of the insurance card, and at that point, that's where they would have to spend an hour or so over the phone and then get about 20 names that they'd have to cold call and cold email in order to get an actual therapist. Now that for someone that's going through some sort of mental health uh, decompensation, that's just not what you're going to do. That's the last thing you want to do. The last thing you want to do is actually get out of bed. So what we end up seeing is that 80% of those who experience mental health care, they actually drop out of the system. And that obviously uh, leads to driving waste in the healthcare system as they continue to with their decompensation. And also, actually, a couple more points. When we look at the statistics, it shows that about 100,000 mental health care clinicians are needed right now to treat the current demand of those who need help. And by 2025, there'll be a need of 225,000 clinicians in order to treat the mental health concerns. And as we'll talk more about this as the questions come, but there, this is a problem that we just cannot throw bodies at because there are no bodies to throw to solve the problem.